Hey, Charlotte, I didn't know you worked out here.
I don't. I mean, this is my first time here. I don't know where to put my stuff well, it doesn't matter. um, it's so good to see you. Do you come here a lot?
Well, I've been coming about 3 times a week for a while now. All that sitting we do at work isn't helping my shape. Here, just take any empty locker, put your stuff in, and you're locked on.
Oh, that makes sense. Thanks. So what kind of workouts do you do here?
Oh, I'm on the elliptical.
That's why I'm here. My doctor just told me I have osteoporosis. I'm so surprised because, I don't feel anything at all. But she said walking is really good also because you put weight on as you walk and that stimulates your bones. Anything that builds muscles like aerobics, weights. I figure if I do it here, I won't make excuses every other day about bad weather.
Oh, don't I know it. That's why I do it here. Otherwise, it would be too hot or too cold every day. So, osteoporosis?
Yeah.
I thought you just needed to take calcium. Did she give you some other medicine for it?
Yeah, she wants me to take calcium, but I'm not sure yet about the other medicines. I'm supposed to go back next week and talk more about it, and she gave me some stuff to read and told me to get on an exercise program.
Yeah, I've heard that helps.
Mm-hmm.
Well, why don't we come at the same time and work out together? Less boring that way.
That'd be great. Make me show up on time and make the time go a lot faster.
Yeah, great. We can catch up on the latest gossip on the elliptical, and maybe you can tell me more about the meds and stuff. I may need to know one of these days.
Maybe I'll know more about it by then. I mean, I don't hardly know what osteoporosis is other than thinning of the bones.
Me neither, but I think women are supposed to know. So, see you Wednesday then? A little after 5?
Perfect. See you then.
Osteoporosis is a condition where bones become more brittle. It can affect men, women, and even young people. But today, we're going to talk about the kind that affects women who have just passed menopause or the change of life. When a woman reaches menopause, she stops making the female hormone estrogen, and in many cases, this can result in her bones becoming less strong. The inside of a healthy bone looks like this. It's dense and spongy. The inside of a bone affected by osteoporosis looks like this. It's becoming hollowed out and brittle. What causes this to happen? All of the tissue in our bodies, our skin, our organs, and our bones are made up of cells. They're constantly dying and being replaced. Of course, we don't notice it or see it happening, except maybe in our skin. The same thing happens in normal, healthy bone. As bone gets old, it is replaced by new bone. But in osteoporosis, bone dies faster than it is replaced, so the inside of the bone becomes thinned out and sparse. Bones affected by osteoporosis are more hollow and more brittle, so they are more likely to break easily. A person who has osteoporosis may not have any symptoms at all until a bone breaks. Most commonly, that's a fracture in the spine or hip or wrist. But any bone can be affected. Sometimes these fractures happen with a fall or from a slight injury that wouldn't hurt a normal bone. Sometimes small fractures can happen in the spine over time that cause the spine to become curved and the woman to be stooped over. She may not even be aware that a fracture has happened. Your doctor can tell if you have osteoporosis by doing a bone density test. It's a painless test called a DXA. It's like an X-ray. Women at greatest risk for developing osteoporosis are those who are white or Asian, women who are thin, women who smoke, and anyone taking thyroid medicines or cortisone-type medications like prednisone or other steroids. Osteoporosis is very common, so common that doctors say that half of all women over the age of 50 will have a broken bone from osteoporosis at some time during their life. If left untreated, this condition won't get better on its own. No treatment can cure osteoporosis, but the drugs discussed in this program can slow down the disease and help prevent you from getting a fracture or broken bone. Osteoporosis is a serious condition. It requires treatment and monitoring by a doctor to prevent additional problems.
Well, we made it. So, how was your first session?
It was fine. And I'm so glad we decided to do this together. It makes it a lot more fun.
That's for sure. We can gossip. But first, you can educate me about this bone thing. Did you read all that info your doc gave you?
You know, a lot of it's about the different drugs they use to treat this, and it's a lot to digest. But it looks like at this point, just taking calcium won't be enough.
If you are diagnosed with osteoporosis, your doctor will want to make sure you are taking enough calcium and vitamin D. Your doctor will also recommend that you get regular weight-bearing exercise. That means walking or careful weight training. That kind of exercise helps increase the density of bones. Other activities that are not weight-bearing exercises, such as swimming or yoga, do not increase bone density, but do increase muscle strength and balance, and can help prevent falls and fractures. Calcium, vitamin D, and exercise are not enough, so your doctor may also recommend medication. There are several kinds of medicines for treating osteoporosis. One class of drugs is called bisphosphonates, another is hormones, and the third is a category of drugs we call SERMS. Denosumab is another osteoporosis medicine. Bisphosphonates are drugs you may have heard of by their various brand names. Names like Boniva, Fosamax, Actonel, and Reclast. These drugs all act by slowing down the loss of bone cells. The most common hormones that are prescribed are those containing the female hormone estrogen. Drugs like Premarin or Prempro or Premphase. These hormones slow down bone loss. Calcitonin and teriparatide are also hormones that are used for osteoporosis. Calcitonin is a hormone that slows down bone loss, and teriparatide is a hormone made by the parathyroid gland that actually speeds up new bone growth. SERMS stands for Selective Estrogen Receptor Modulators. They act like the hormone estrogen, but they aren't hormones. One SERM drug you may have heard of is called Evista. SERMs act by slowing down the rate of bone loss. None of these drugs cures osteoporosis, but all three of these drug classes have been shown to help prevent fractures in the spine. Most of them also have been shown to reduce fractures in the hip and other bones as well, but research on some individual drugs is not yet complete. Each of the drug categories has a different way of acting, and therefore they have different side effects and risks, and you will want to know more about these in order to work with your doctor to find the best one for you. In the next segment of the program, we're going to look at each of the categories in more detail.
At a routine checkup, my doctor said it was time for me to have a scan to check my bone density. I didn't think it was necessary since I didn't have any aches and pains. He said you don't normally feel osteoporosis, so I had the scan, and he showed I had osteoporosis. I was surprised. That was 4 years ago, and I've been taking medicine for osteoporosis ever since. My doctor said that the medicine would only help slow the bone loss and that this would help me from breaking any bones. He also said that the wrist is one of the most common bones to break, as well as the spine and the hip. Of course, any bone is capable of breaking. My doctor also told me to take calcium with vitamin D every day to keep my bones healthy. A week ago, I slipped and fell on my arm and went to the ER where they did an x-ray. Luckily, it showed I hadn't broken any bones. The day after the accident, I called my doctor's nurse and I told her about the fall. And she asked if I'd been following the exercise plan my doctor gave me with the meds. And I said, "What exercise plan? I usually just do house chores when I get home. I didn't realize I was supposed to be exercising." The nurse said that weight-bearing exercise, which is exercise you do standing on your feet, like walking, going up the stairs, or dancing, helps to strengthen the bones and helps to prevent you from falling. She also said that lifting weights can make my muscles and bones stronger. So I signed up at the gym, and tomorrow I will start doing some exercises. I'm so excited.
So why do I have to know all that? Won't the doctor just give me a prescription for the best one?
Well, you would think so. But it sounds like there are quite a few things that might go into the decision for any one person.
Well, I do wonder why some are pills and some are shots. And I've noticed that there's a lot of difference in the prescription price, too.
So those are the questions you better ask. And I always wonder about side effects. Maybe some are easier than others in that regard.
True. I wonder, too, how long I'll have to take these medicines.
A lot of questions. Sounds like I better make a list.
Remember, there are several types of medications for osteoporosis: bisphosphonates, denosumab, hormones, and SERMS. Within each of these categories, there are several different drugs, and there are differences between them you will want to know about. They differ in the way they are taken, how often they need to be taken, in the way they act, the kinds of side effects they have, and how much they cost. You can find information about individual drugs in this booklet. For now, let's look at each of the categories in a little more depth. If you were diagnosed with osteoporosis, your doctor will most likely recommend one of the bisphosphonates, like alendronate, ibandronate, risedronate, or zoledronic acid. These drugs do not speed up new bone formation. They act by slowing down bone loss. There are several to choose from, and the main factors in choosing between them are how the medicine is taken and how often. Most bisphosphonates are pills. Some are taken once a week or once a month. Many people prefer pills because they're easy to take. However, these pills can be hard on the esophagus. That's the tube that goes from your throat to your stomach. So when you take these pills, it's important to take them on an empty stomach with a glass of water. Then, for the next 30 to 60 minutes, you must not eat or drink or lie down to lessen the risk of the medicine washing back into your esophagus. People who are not able to do this, or who have had stomach ulcers or esophagus problems, may not be well suited to the pill form of bisphosphonates. Bisphosphonates can also be given through your vein by intravenous. These are given at the doctor's office. These forms of the drugs only have to be given once every few months, or even once a year. Many people have no side effects from bisphosphonates. Others may report stomach upsets and heartburn, and some women experience bone pain. There are some other rare but serious problems that have happened in some cases and are therefore risks. One is damage to the esophagus. Another is where the bone in the jaw breaks down. Another where a fracture, a break in the thigh bone happens. Although these medicines prevent the most usual kinds of fractures, they can cause these other fractures called atypical, because unlike normal breaks, they happen in a less common spot in the thigh, and they can happen without a major stress or injury to the bone. These risks are rare and mostly happen in women who have used the medicine for a long time or in high doses. Denosumab is another osteoporosis medicine. It is a shot given at your doctor's office every 6 months. It slows down the body's natural process of breaking down or removing minerals from bone. Denosumab might increase the risk of getting infections. The other osteoporosis medicines are hormones and SERMS, which act like female hormones. These drugs do not speed up new bone formation, they slow down bone loss. All of the female hormones, estrogen or estrogen with progestin, and the SERMs that are estrogen-like, come in pill forms and are taken once a day. They all carry a slightly higher risk of blood clot formation than some other drugs. So of these drugs, the female hormones or SERMs are usually not suitable for a woman who has ever had problems with blood clots or stroke. Some women who take medicines that contain estrogen have reported uterine bleeding, breast tenderness, and menopause-like symptoms. Medicine containing estrogen is associated with a higher risk of breast cancer. SERMs, on the other hand, appear to reduce breast cancer risk. The other hormones, calcitonin and teriparatide, are prescribed less often than the other drugs we've mentioned. They do not come in pill forms. One is a nasal spray and the other is taken as a shot. They are all taken every day. Teriparatide tends to be more expensive than some of the other drugs. However, for women who can't take some of the other medicines, this can be a very good option. Teriparatide is the only one that actually stimulates new bone growth. So if you are at very high risk for fractures, your doctor may consider prescribing it for you. Because osteoporosis medicines are powerful, they also have the potential for unwanted side effects, and some of these can be serious. Be sure to read the drug information sheet that the pharmacist gives you so you can be alert to any unwanted reactions and report them to your doctor.
Doctor, I have some questions about my medication.
Good, good. Let's talk about it.
Well, I brought a list, but I did want to ask about...
Your medications may need to be adjusted over time. You won't be able to feel how well your medication is working on your bone density, so your doctor needs to see you regularly. It's important to keep all of your doctor and clinic appointments. Remember, the goal of osteoporosis treatment is to prevent further loss of bone mass and potential fractures.
I was told I had osteoporosis after going to the ER for back pain. They did an x-ray of my back, and the osteoporosis was so severe that it showed I had a compression fracture, which was kind of like a crushed bone in my back. I didn't know how I got this. The ER doctor said as you age, your body loses minerals like calcium, which is needed to build bone. Hormones like estrogen help bones from breaking, and so postmenopausal women like me who have less estrogen are more likely to have osteoporosis. My daughter, who lives out of state, visited me a few months ago and said how much shorter I'd gotten. So I went to my general doctor, and she ordered a blood test and a bone density scan. They call it DEXA, to confirm the osteoporosis. In the meantime, I was told to take calcium and vitamin D supplements every day because women need more after menopause. She also told me about doing weight-bearing exercises and then gave me a prescription for an osteoporosis medication. She told me osteoporosis is when the bones become less dense, weak, and easier to break. I asked why I got osteoporosis, since I'm thin and healthy. At least I thought. She said women who are more likely to get osteoporosis after menopause are smaller and thinner women, or who are of white or Asian descent. They often have family members who have osteoporosis and have broken a bone. Women who smoke or drink too much alcohol and take certain medicines like steroids or thyroid replacement also have a tendency to develop osteoporosis. My friend told me of an osteoporosis medication, but my doctor said I needed a different type of medication since I have a history of stomach problems. Evidently, there's several types of medications to treat osteoporosis, and each one has different possible risks and side effects. It's been a year since I've been taking one of these medications, and I feel so much better. My back no longer hurts like it did, and now I can take my walks in the evening.
Well, that's another session done.
We've been really good at this. It's so much easier when it's a routine, and I have somebody to gab with while I do it.
Oh, I'm so glad we started doing it. My mom's been diagnosed with osteoporosis now, so I know I need to do this.
It's good for us in a lot of ways. I'm sure the exercise and the medicine is the reason I got a good report from my doc last week. No more bone loss.
That's great. I don't know yet what kind of medicine they'll put my mom on.
Well, I learned a lot about that, so I'd be glad to help if I can help in any way.
I'm going with her to her doctor next Monday, so we'll talk before then. I need to figure out what questions to ask.
Okay, well, I'll see you Wednesday.
Okay, see ya.
About 6 months ago, I went to the beach, and as I was getting out of the ocean, a wave hit me. It knocked me down. I ended up breaking my wrist. I had a bone density test over a year ago and was told I had osteoporosis. Of course, I didn't believe it since I walk daily and I eat healthy. My doctor said I was at risk for having fractures and I needed to take medicine for osteoporosis. The medication that was prescribed had side effects that were a concern to me, so I decided not to take them. After breaking my wrist, I went back to visit my doctor, and she said that there are different types of osteoporosis medications, and each type has different side effects. They can also vary in price, ranging from reasonable to quite expensive. So she put me on a medicine different from what a friend had recommended. I have been taking it for a few months now, along with calcium and vitamin D, and I haven't had any problems. She also put me on a daily exercise routine to help strengthen my muscles and bones, which she said will help in preventing falls. I definitely have seen an improvement in my strength, and I haven't had any other falls. I'll be going in for my 3-month follow-up with my doctor and share the good news with her.